You know, every single medical decision, from a simple checkup all the way to a major surgery, is backed by evidence. But have you ever stopped to wonder where that evidence actually comes from? Well, today, we're going to open up the researcher's toolbox and see the exact instruments they use to build it.
It all really boils down to this one simple but honestly pretty profound question. How do we know what actually works best for patients? I mean, how do we get that reliable, trustworthy evidence we need to make the absolute best decisions?
The answer, thankfully, isn't just guesswork or doing things the way they've always been done. Nope, it lies in a really rigorous, systematic process that's designed to find clear, verifiable answers.
And that process? It's called nursing research. And let's be clear, this isn't about tradition. It's a formal, scientific investigation. Its entire purpose, really, is to challenge what we think we know and replace it with solid, hard evidence, all to improve how we care for patients.
Okay, so let's get into it. For any research to work, you have to collect data. It's the foundation of everything. And to collect good data, you absolutely need the right tools for the job.
In the world of research, these tools are called instruments. Now, think of them as basically any device that's used to measure something. It could be a patient's pain level, or it could be their blood pressure. The most important thing is that the instrument has to be precise, because if your measurements are off, well, your conclusions are going to be way off too.
I find it's really helpful to just picture a specialized toolbox. You wouldn't use a hammer to turn a screw, right? It just doesn't work. In the same way, a researcher has to pick the absolute perfect instrument for the specific question they're trying to answer. So what's actually inside a nursing researcher's toolbox? Let's crack it open and take a look at some of the most common instruments they're working with.
And wow, the variety of tools is pretty incredible. You've got instruments to capture what patients tell you, like questionnaires and interviews. Then you have tools to record what they actually do, like observation checklists. And finally, you have all these tools to measure what their bodies are experiencing, things like blood pressure cuffs or heart monitors. Each and every one captures a different piece of the puzzle.
So to really see how this works in practice, let's pull one of the most powerful and versatile tools right out of that box, the interview schedule.
To put it simply, an interview schedule is kind of like a researcher's script. It's a set of pre-planned questions. But this isn't about being rigid for no reason. It's to make sure that if you're interviewing, say, 100 people, you're asking them all the same core questions. That's what makes the data comparable and fair.
So you might be thinking, why not just hand out a form? Well, this tool is just so valuable when you're digging into complex or sensitive topics. It's also often the best choice for participants who might struggle with a written survey. Think about children, the elderly, or maybe someone who can't read or write easily.
And hey, not all interviews are created equal. A structured interview is like a very strict script. You don't deviate. A semi-structured one has its core questions, but it also allows for follow-ups and a bit more exploration. And then you have the unstructured interview, which is the most flexible of all. It unfolds more like a natural conversation, which is great for capturing those really unexpected insights.
This all brings up a really key question. Why would a researcher go to all the trouble of conducting an interview when they could just send out a simple questionnaire? Let's take a look at the trade-offs.
The trade-off here is crystal clear. With interviews, you get this incredibly rich data and a super high response rate. Most people will actually participate. But, and this is a big but, that comes at a high cost in both time and money. Questionnaires, on the other hand, are cheap and fast. The risk? You can get very low response rates and sometimes pretty shallow answers. So it's this constant balancing act between resources and the quality of the evidence you're trying to gather.
And this is why interviews are so often seen as the superior method for complex research. An interviewer can clarify things that are confusing, they can probe for deeper meaning, and they can capture those spontaneous reactions you would just never get from a static form. It's really the difference between just collecting data and hearing a real human story.
When it's all said and done, it all comes down to this. No matter which tool you pick from that toolbox, whether it's an interview, a questionnaire, or a physiological monitor, the goal is always the same. You're trying to get measures that are relevant to your question, that are highly accurate and completely objective.
Ultimately, every single instrument is just a means to an end, finding answers. And that leaves us with a really fascinating thought to end on. A tool is only as good as the question it's built to answer. So that makes you wonder, what's the next big question in healthcare that's just waiting out there for the right tool to be invented?